and all that. What they are saying in essence is they have head pain. So if you look at the word analgesic, many of us say it a lot. Give me paracetamol. I want to go and take analgesic. So if you break down the word analgesia, it's still carrying the word algesia. But if you see the word an preceding as a prefix to any Greek medical word, it means the absence of that thing. So if you see the word anuria, for example, if a patient is on my ward on admission and throughout my 12-hour shift, they've been anuric, that means they've not made any urine, and that's a red flag. So if you see the word ahen before any medical term, it means the absence of. So when you're taking analgesia, you are taking something that will make pain absent. From that, as a way to open. So if I say something is, if I'm talking about neurogesia or neurologic pain, what do you think I'm talking about? Neurologic pain. What do you think I'm talking about? Because some of us have all of these BAM. They say, is not musculoskeletal. It's for the neurons or it's neurogesic. What do you think that is talking about? If something is neurogesic, what do you think is about? What do you think is affecting? From this little explanation. Neurogesic. Who wants to give us a try? Just try. Just try. You just been rubbing balm on your body. You don't know what it works for. So if anything is neurogesic, so basically we're looking at the two Greek root cause. So neuron, nerves, and gesic, pain. So if you're taking something that is neurogesic in nature, perhaps it's something that has to help you take away nerve pain. Because at times people come with pain, and when they do scans and all that, you see that the origin of that pain is not musculoskeletal. It's coming from maybe a nerve, maybe the root, or something is pressing. Maybe a bone is pressing on that nerve. And that's where they're having that pain. All right, let's go to the next slide. That's just for a way to make. So if someone comes and they say big grammar, cephalgia, it means basically headache. So headache refers to pain in the head. So those are some of the locations where people can tell you they're experiencing headache. They can have it in the head. They can have it along the scalp. They can have it in the upper neck. And it affects all ages and all groups. Then what are the different types of headache? I told us the other time that there are different classifications for headaches, but I'll be narrowing it down to primary and secondary headaches. Headaches are classified as primary in cases of headaches like migraine, tension headaches, or secondary. So the only distinguishing factors when you're talking about headache is if it's primary, the headache is the disease. Do we understand? So if someone has a headache, that the headache itself is the disease, is primary cause. But if the headache is as a result of another condition, maybe that person has got they were involved in an accident, they had a whiplash injury. So what was a whiplash injury? And that's why we advise people to use their seat belts when they drive. So basically a whiplash is when before the impact happened, if it threw their body back and it came back forward. That's a whiplash. So after that kind of injury, for example, some people develop maybe compressions along their spine and they have recurrent headache. That headache was not there before that accident. So that headache type is a secondary headache. It's happening as a result of another medical condition. So what are the things we need to look at? So when we're talking headache, one way to track what type of headache it is we're looking at the location, the intensity, the duration. What are the other signs that are associated with the headache? Then recognizing the pattern, and red flag is also essential for timely medical care and effective management. So as we go ahead in this discussion, and we'll look at, because I said we have about 20 headaches, but we've been able to sieve it and know the ones that might be particularly important to us. Let's go to the next slide. Okay, keep going, man, please. Next slide. Okay, I've said this. Keep going. So this is what I just said the other time. If it's primary cause, the headache itself is the disease. If it's secondary, then it's as a result of another condition. So for primary headaches in itself, so in your mind, draw two broad categories. We have primary on this side. We have secondary on that side. Then for the primary ones, one way to also note them is you are looking at the pattern of that headache. So is it episodic? That means it occurs occasionally, but more than 15 days in 1 month. They can last anywhere from half an hour to several hours. But if it's chronic, it's more consistent. They happen more than 15 days in a month, and in these cases, a pain management plan is necessary. Along the line as we go, you look at some other types of headaches, and you'll be able to track more efficiently. Next slide, please. So this for primary headaches. Keep going. Yeah, so tension headache, for example, it arises from stress. So most times when people are stressed, and when I was looking at that, I said at times when some mothers, when their child starts to throw tantrums, they say, don't give me a headache. Most times what they are referring to is don't give me stress, because for it's the stress that later on graduates into headache. Yeah, I won't take us into all of the anatomy and the physiology of the pathways where we have the serotonin, dopamine secretions in the brain, and we don't need all of that neuroanatomy. But there are some things that stand out. And I was just thinking, someone said, if you have, and it's happened to a lot of us, maybe some of us while we're in Nigeria, that you are charging a phone in a neighbor's house, or you're charging the phone close to your window, and before morning, your phone is gone, but the charger is there. You know that headache you will first feel. Is tension headache, and that's the tension is as a result of stress. So anytime stress happens in the body, two major, let me say, neurotransmitter hormones are released. That's cortisol. If you see someone that is always having very bad sleep patterns, they're always awake all night and all that. So if there is a stressful situation, cortisol levels is heightened, and it's supposed to be an emergency hormone. It's supposed to stay there for a while, and over time the levels are supposed to dip. But if someone has a sustained cortisol level, maybe because of bereavement, they had a very emotionally disturbing news, and their cortisol levels become so high, it keeps getting increased over time. Over time, all of that will accumulate and be a factor that is causing stress. So two major hormones that I found that might be causes of this kind of stress, we have cortisol, we have adrenaline, those two. So in fight or flight situations, in situations where there is increased and sustained stress levels. And the other time that Sister Comfort was teaching us about stress and stress management, these are some of the culprits that lead to maybe poor sleep and all that. We'll be looking at more of cortisol levels when we have things like headaches that are psychologically or psychiatric caused. It's one of the major culprits there. So what are the characteristics of a tension headache? It's like a band around the scalp of the head. So the person feels like you're tying rubber band around the scalp of their head. Another type of headache is dehydration headache, results from insufficient fluid intake. If I may ask, how many liters of fluid should we take on the average in a day? 2 liters, 4 liters, 3 liters. It's said that averagely we should take that's about 2 liters, 2.5 liters. But many of us don't drink that much. And for people that don't drink that much water, they would be prone to this. So it's a dull or throbbing pain that gets worsened by movement. So for some of us, when we feel that kind of pain, what we need to do most time is maybe, and I've said for these two types of pain, lifestyle factors like hydration, stress management, and rest. Ergonomic stress management, rest, and prevent relieves these kinds of headaches efficiently. Let's go to the next one. Okay, I'll talk a little bit about migraine and why I've picked particular interest in migraine is because of some of the factors that are associated. Is a type of primary headache, but for some persons they have this migraine aura. And I found that there is this thing called aura. It's for people that are also having seizures and all that. The first stage of a full tonic-clonic seizure is something called the oral stage. So because it's been estimated that the amount of electrical energy or activities in our brain can power a bulb throughout the day. Like if you get all of the electrical wiring and all of that in the human brain. So there is a lot of electrical activities. For people that are going to have maybe a full tonic-clonic seizure, that you see the person full seizure, they're having spasm on the floor and all that. Many a times when they come back, when you ask them what the experience is, for them they'll tell you they had this oral phase. So for them, some of the oral feelings is, they'll tell you that they have this characteristic smell. Or I used to have, bless her, now she's fine. I used to have a colleague like that. Anytime she's like that, she just starts to be phonophobic. And coincidentally, for migraine, that's one of the factors, or those are some of the things that triggers it. So for migraine kind of aura, they tell you that they are seeing zigzag lines. Some of them will tell you that they are seeing zigzag lines. Some of them will tell you they are seeing blind spots. Some of them will tell you they are seeing stars and all that. There is a condition that looks so much like migraine, but it's not migraine. It's called It's called, what's it called? I'll bring my notes. So the difference between it is for migraine stays on one, it can move across. So these are the things to know about migraine. So if it's a migraine headache, it can be on one side of the head. Then it lasts about 4 hours to 72 hours, but it can move to the other side of the head. And for migraine at times, caffeine has been said to be something that can cure it. If people take caffeine, it can help them, it can stop. And in fact, in management of migraine, I'm running ahead of myself now. In management of migraine, it's been noted that caffeine is added to some of these medication you give to relieve it. So you give something like caffeine plus cocodamol to treat migraine in the initial phase of it, if it's migraine headache. But the other type, I'm going to get the name for you. It's not English name. So that type of headache itself, it stays on just one half of the head, and it can be there for 3 months. And the difference between it and migraine is migraine can go by itself for 7 to, like I said, to 72 hours. The person might be fine. So the headache might come on and off. But for that type of headache, it just stays on one part of the head, and it can be there for 3 months. Another thing to note, or that you will know that it's not migraine, if you give anybody that's got migraine, if you give them triptan, there is a class of medication, it's called triptan. If you give them triptan, the headache goes for migraine. But for that other one is indomethacin. Let me check the name for you. So I stop referring to it as that other one. So that one is hemicranial continua. Hemicranial means the headache is happening on one half on the head. And continua means the pain is persistent, it's just there. And some of the other distinguishing factors that I've said here is that for the hemicranial continua, it can be for up to 3 months, and it's on one side. But for migraine, the difference is it dwindles 4 to 72 hours. If you give caffeine at the initial part, it might be relieved, and of course, it gets treated by triptan. Okay, so cluster headache. It happens, it's just like a pricking pain. It happens, you can't really tell by the location of the headache. It just is everywhere. It's like another type of headache that looks like this is called the eye peak headache. It's just like the person has pins all over. Causes intense unilateral pain around the eye with tearing and nasal congestion in cyclical patterns. So we'll go very quickly to secondary headaches. I said it the other time. Can you go forward? Keep going, ma'am. Just keep going. I've said a couple of things about these ones. Yeah, so for this one, there's something called a rebound headache. For medication overuse headache. So it's been said that if you use many of these analgesic agents for more than 15 days, people are at risk of having a rebound headache. So what is supposed to take headache away now starts to give them headache. That's in the case of this one, medication overuse. I've talked about this one. Whiplash, I talked about it. And of course, this is when the headache is due to something happening in the CNS of the person. Can we go ahead, ma? Next one. Types of secondary headache. And these are some of the ones. So the first one here is a thunderclap headache. It's self-explanatory. Kind of headache that can shut down when it is like they are clapping or they are playing drum set on the person's head. It doesn't last for more than 1 minute, but it is debilitating. Like if it happens, the person has to literally stop. You can imagine if something is thunder, like, CAC clap in the person's head. Duration is about just 1 minute, but it is massive, intense pain. Allergic or sinus headache. For people in seasons like summer seasons, people are exposed to this. So the pain is around the sinus of the nose. That is where they will be feeling the headache. Is around this place. The concentration of the pain is usually around this time. And you will find this type of headache around seasons like this and during falls. That's when people get more predisposed to it. Hormone headache. This is, of course, it's also called menstrual migraine. It happens like the 3rd day before menstruation to about the 3rd day after menstruation. Some women experience it. They experience it and to maybe before ovulation. Some women tell you that they're experiencing headache. This is as a result of fluctuations with the estrogen level. So women of menstrual ages, premenopausal, postmenopausal women, they experience that type of headache. For caffeine headache, for many of us, and it was interesting and I loved what I saw with this. For some of us that take caffeine to stay awake, at the initial part, what caffeine does to you is it reduces blood supply to the brain. So what it does is it goes to the receptors in the brain. There's something called adenosine receptors. So it will block there, and what it does is a receptor blocker. It stays where as adenosine should bind with. Do you understand? It stays there in the meantime. So adenosine is a vessel dilator. Adenosine, if you give someone adenosine, you are telling it to enlarge all the blood vessels in them and allow blood. But caffeine, what it does is it restricts or constricts blood flow. So at the initial part, it would start to do the work of vasoconstriction. But if the person discontinues caffeine all of a sudden, like the person takes 2, 3, 4 cups of coffee every day, and it's caffeinated coffee, and they withdraw those 4 cups, they will have a headache. Do you know why? All of the adenosine that's been stopped all this while, they just rush into the cells. So the blood vessels in the brain are very dilated, and the person will end up having a headache. It's called a dead turkey syndrome. So that's another example of headache caused by caffeine. Exertion headache. This is when people do exercises like weightlifting, running, at times even after lovemaking between couples. It lasts few minutes to several hours for some persons, and it subsides. Exertion headache, that's the one. Hypertension headache, and I said I was going to say 1 or 2 things about this. This doesn't come up until the blood pressure are estimated to be around 180 systolic, 120 diastolic. So if anybody is hypertensive, and all of a sudden they start to feel headache, it's an emergency. Call 911. They need to get you to the hospital as soon as possible. It's debilitating because it gets worse. The person is unable to do anything. They can't move and all that. So at the level of having that, if it's not properly managed, it can lead to a stroke. I forgot to mention about migraine headache too, that some of the signs people feel and why they might need to call the hospital is some of the signs mimics the initial signs of a stroke. So some persons will tell you that they are feeling involuntary movements or something like a palsy on one part of their body. So it's safe to just call the hospital just so as to be sure it is not a stroke and not just literally just headache they are battling with. Rebound, I talked about it, post-traumatic spinal. This as a result of a procedure called lumbar puncture. So if people have gone for a lumbar puncture, maybe there has been an analysis of the cerebrospinal fluid in someone, and we need to do a lumbar puncture. So what you do is you tap into the lumbar vertebra of that person, and you take some of the cerebrospinal fluid. They can later have headache. It might be a few hours, 2 or 3 days afterwards, or many months later. And for women that take epidural during pregnancy, they're also at risk of spinal headache. Keep going, ma, please, very quickly. I wish I can get to the part, because I'm running out of time and we need to take questions. Keep going. I think I mentioned some of this already. Yeah, keep going. Okay, so these are the difference between migraine and the hemicranial continuum. I said most of the things, so I think the slides will be available so that we can look at it. Next slide, ma'am. Okay. Thank you. So these are, for the different types of headache, this gives an overview of where the pain is and how to know what type of headache the person is having. So if it's tension headache, like I said, just like a band around the scalp. If it's migraine, it's one-sided. If it's cluster, it's around. People feel the pain most around the orbits of the eyes. If it's allergic or sinus, it's around the sinus of the head. If it's caffeine, you'll note that caffeine, exertion, and hypertensive headache, you would see this similarity. You see, this is where for those 3 types of headache, this is where the pain is always felt. Hormone headache for women, please keep going. So for caffeine, can you see? Caffeine, hypertension, exertion, the same pattern of headache. That's where they will feel the pain. Please keep going, ma'am. I think I should be wrapping up now. Keep going, ma'am. Okay. Some of the home remedies and self-management for headaches: adequate hydration, drinking a lot of water, rest and sensory reductions. For some of us, we love to be on our screen for a long time at night. Some of us, I used to do something funny at work. So I would turn off the lights in my office, and the only bright light I have access to is my screen. And someone has corrected me and said, that is even worse. Because for me, I was feeling that I was having sensory overload. Because the light is bright enough with the light coming from this. But I said, no, you are doing it all wrong. I said, you are putting your eyes in greater risk. He said, the way to do it is keep the light on so that you minimize the impact of the bright light coming from the screen. Some of us, we even turn up the lights in our room, and we are on Instagram and we're taking feeds. What you will notice is you will not be able to sleep. And for some of us, having been on the phone for so long, we end up having headache. pain relief. Cold compress on the forehead, it works. Warm compress on the neck helps relieve different headache types. Stress reduction, gentle stretches, massages, mindfulness, reduce muscle tension and stress-triggered headaches. Go forward, man. Keep going. So I would just give us this acronym that's going to help us, or that we can use to advise anybody if we think they're having headache, so that they can get to care as much as they can get to care, or we can use it to track when to know if there is actually need for concern. It's called SNOOP. That's SNOOP. So number one is the headache. Is it also coming with fever, with weight loss, with night sweats? If all of that's happening, is talking about something different. For example, night sweat is something that stands up for tuberculosis. If someone is having headache for it, it's more than just headache. If they're having a high-grade fever, it's telling you that it's not just headache. There might be underlying maybe systemic infections that they need to treat. If it's in neurologic, so with the headache, is the person having confusion? Is the person confused? Is the person displaying other characteristics? For example, if someone has been bitten by a rabid dog, apart from the headache, they become photophobic. So if you put on, especially in the later stage of it, I've lost a patient like that before. If you put on a bright light, they get very agitated. You will see them manifest that symptoms. And for someone, and if someone has been infected with tetanus as well. So if there is an irritation of the meninges of the central nervous system, you see signs like being photosensitive. You see signs like throwing the head backwards. It's called oppositotonus. So they would keep throwing the head backwards even when they are laying down. So if they're having that kind of headache and they are exhibiting other signs like that, it's telling you that it's not just headache. There are other things to look out for. One, another thing is the onset of the headache. Is it just early onset? So for someone that has suffered maybe anything to do with their nervous system, maybe they've had any injury around their head injury, and is leading to headaches. One of the things they will feel every morning is they will have a constant headache every morning. Yeah, that's for that. So is it early onset? Is it sudden onset headache, and what's the intensity of the headache? Is it just there and it's so bad? And so if the headache is just there, if the person is above 50 years of age and they are complaining of very severe headache, it might have to do, maybe there is a bleed somewhere in their brain that needs to be looked at. So age is another factor. The other O is older age. Then finally the P, the pattern change or progression. Is it a first or worst headache? Is there a change in the frequency, severity? Is it more than 15 days? Is it something that keeps them debilitated for about 1 minute they can't move? Is it on one side of their brain? Is it on one side of their head they are feeling the headache? Are they able to walk when they have the headache, and all other things like that? So with that, I think we have come to the end of this presentation. Do we have questions? Questions.
Did he do well, or you were just open to agent? Did he do well? He did well? Okay.
Praise the Lord.
Huh?
Thank you so much for the information shared. I'd like you to expatiate more on the spinal headache. If there is anything to do to relieve that, and how long should a woman expect to have that? Because in my own case, I have epidural 4 times, maybe 5 times, because one was for a surgery, another one was for delivery of my kids, and I used to have the headache constantly for 17 years. So what do I do?
I think number one is you might need to have a speak with your GP. Of course, there might be other things to look at, because there might be exacerbating factors and alleviating factors. I know that for long-term or chronic conditions like that, there might be things you do that aggravate it. At times, the headache might not be as pronounced if you are not stressed. But maybe when you've exerted yourself, then it becomes really, really bad. So at times it might be about lifestyle modification, doing things, minimizing the amount of stress you are exposed to. Then, of course, long-term management of medication that has been. I know that over time the dose would have to be increased to be able to keep up with to keep the pain at bay. But I think you still have to have regular check-ins with your doctor and all of that. Then prayer, you will need to see pastor. Thank you so much. But did I? Oh, and if you have any other question, please see doctor. Okay.
In a situation whereby you can take the pain relief for a certain reason, because in my own case, there are some pain relief I cannot use. And in this case, like you mentioned, stress, I noticed that, but I understand that entering into menopause make it worse. And I can't take, like, most of the cocodamol, which is being given in this country, is too much for me to take. So, home remedy, what type can you suggest?
Okay. I think the thing is, medications that, or things like turmeric. I know turmeric is an anticoagulant. I think by extension, it might do the function of maybe vasodilation, helping with good blood flow and all of that. Yeah. Then another thing is just watch things you eat. So caffeine, coffee. You might be someone that for now you'll be off coffee because it would of course constrict your blood vessels and make the pain worse and all of that over time. So over time we can, many of these vegetables, many of these natural remedies, veggies, ugu, vegetables from Nigeria are very good with blood supply, helping with vasodilation, and even some of these foods that are recommended for hypertensive patients that helps with dilating blood vessels will be very, very handy in this situation. Thank you, ma'am.
You said that when there's this caffeine that can treat migraine, but you also now said there's a caffeine-induced headache. So how do you balance that?
So the initial part of migraine management, caffeine is always prescribed. It's prescribed will be in small quantity, but if the migraine has been managed and the person wants to be off the caffeine, it will be gradual. It won't be a sudden withdrawal, because what caffeine does is it constricts blood vessels, and in order to do that, it binds with certain receptors. They are called adenosine receptors. What they do is they allow blood vessels to dilate so that blood can pass through. So what it does is it will bind with that receptor. As long as it's there, the adenosine is unable to bind with the receptor to allow the blood vessels to open. So if the person now stops taking caffeine all of a sudden, all of the adenosine that are around the blood vessels, they will just rush in, and that will cause the person to have a headache.
So that means it's not good to take coffee.
No, the person can take coffee, but the person watches for. No, of course I know. Of course I know. The person can take coffee at the initial part, but if they need to be off coffee, they should withdraw gradually. And there is decaffeinated coffee anyway, sir.
Thank you. Is there a limit to how someone take paracetamol pain relief? Because I'm of the opinion, like someone that is always having headache, and most of the time is usually from stress, or because for me, if I have headache or I'm stressed, if I sleep, even if it's 30 minutes, I'll be refreshed. I'll be like, you have to limit is there a limit to how often you take pain relief?
There is, definitely. Paracetamol is hepatotoxic. That means it's bad for the liver. And in fact, I've heard from a friend that said the dad, first thing he does in the morning is to take paracetamol. Like he's waking up from sleep. He has not even entered into the day. He's not had a stressful day yet, but we just pop to paracetamol before he goes out. There are some people that take painkillers that much. But what happens over time is it damages their liver over time. So much that, and because they are used to, some persons take even 3 times, they take morning, afternoon. Now, with that damage the liver, and if the liver gets damaged, what happens is there is increased serum level or concentration of that medication. So this is it. If the person takes those 3, takes a morning, afternoon, night, the amount of paracetamol in their body system, the liver is not able to keep up to metabolize it. So it stays at that high concentration for a long time. And don't forget, the next morning they will still take 3 times. So in a week the levels will be so high that it can shut down all that. So they might be having even kidney involvement over time and all of that. So like I would always say, if it's for most people that have recurrent headache, there might be things they are doing that they are not paying attention. If they correct those things, they necessarily do not need to take medication all the time to manage headache. Thank you so much. Doctor, do you want to say something? Do you want to add something?
Thank you very much. Very, very good presentation. I just want to add a few things because of the age group of people that are here. Just some examples of some headaches that you should look out for. For women, if you notice your period is not regular, you're having a headache, it could be related. So, and you're noticing, for example, breast milk coming out of your breast, your period is not regular, you're having a headache, there's trouble with your vision, it could be related, and it could be the reason why your period is not regular. So that's one thing you should note. You mentioned thunderclap headache as well. It's a very, very important cause of headache. It's actually caused by bleed in the brain. So if somebody has that thunderclap headache, it's a very, very severe headache. You need to go to the hospital immediately. It could be a bleed in the brain. Yes, you also mentioned spinal headache. Spinal headache, usually we expect it, usually when they take those samples from the back, they'll tell you to lie down for some time. A lot of women in Nigeria, they expect that are strong, so they quickly stand up. But we don't expect it to be the cause of the long-term headache. So as I said, it could be other things that are causing you to have the longer-term headache. Well, thank you very much. Very good presentation.
So is it only the thunderclap headache we should be concerned?
No.
Because another question is, what kind of headache that if somebody is having will warrant a CT scan or a scan?
Okay. So you tried to mention some of the Snoop, isn't it? So if you notice, if you're somebody who's been having a headache for a long time and you notice the change in the pattern of your headache, so even if you've been having migraine for a long time, and then let's say your migraine normally you have your aura, but then this one is different. Normally, let's say, so there's something called hemiplegic headache, which was trying to say it looks like a stroke. Let's say normally this person's headache, this arm will be weak, but now this time around it's the left hand that is weak. You need to go, they might need to, because it is a change in the pattern, so it needs a new investigation to be sure that maybe it's still the same. If you notice that your headache normally, you're usually able to manage it with paracetamol, but this time around you have used everything you have in your house, it's not going away. It's a change in the pattern. It needs a new investigation. If you notice that you're having trouble with your vision, usually those kind of headaches, it can be something in the eye that could make you lose vision in your eye forever, like a glaucoma. It could cause a headache as well. So those kind of ones, you need to go to the emergency. Another type of headache is, for example, a very bad headache and such that if you touch this part of your head, it's very painful. Like if you touch the skin, you need to go. Those are there are some emergencies. So unfortunately, if you come to the ED, for example, and we send you back, it's just because we have seen that it's not an emergency. It doesn't mean that person doesn't have a serious something. And headache is a symptom, it's a serious symptom. So if you're talking about ones that require scans, there are things like, say somebody is on blood thinners. You know, this, for example, like things that make the blood not to clot quickly. We don't really class as brain as yes, it is, but we don't really class it as one that we expect a serious bleed from. But people on blood thinners, if they have any head injury, they have any headache, they might do a scan. Elderly people, we're not talking about elderly people here. Elderly people, they fall down, having some kind of headache, it requires scan. Someone wakes up every morning, the headache is really bad, it feels like vomiting. We'll be thinking, is there a tumor that needs to be? But then, it doesn't mean that every time you have a headache, they will do a scan. They will try and see if it fits something that can be serious.
Thank you, doctor. Father, we thank you. Thank you for yet another wonderful opportunity to learn at your feet. We ask, Father, that we are made whole, our health is intact. Thank you, Father, because we prosper with these things. We even help others with this understanding. Thank you, Father, because our week is blessed. Our health is intact. We walk in perfect wholeness. In Jesus' mighty name.